Hello, welcome to a presentation on the respiratory system. We're going to take time today to understand both what the respiratory system is and how it functions, and in what ways that practically affects us as clinicians and as speech-language pathologists, and in which ways we need to understand it better so that we can effectively be doing our job and be able to understand how this system just affects speech production as a whole. So to start off, it's important to know that the respiratory system is made up of our lungs, the trachea, the diaphragm, and then the rib cage. And the purpose of the respiratory system is to be able to create breath. So through inhalation and exhalation, which inhalation is breathing in and exhalation is breathing out, having the possibility for the lungs to fill up and to close and to create this process of breathing in and breathing out. So now specifically within the lungs, this is going to be where gas exchange is occurring in the body. And so the lungs are going to generally be what we think of when we think of the respiratory system, but they are not the only part of it. It is much bigger than just that. So this is just the specific site where the gas exchange is occurring between the organism and the environment. Some basic understanding of it is to see that there is a right and a left portion of them. Clearly, we have two different lobes. The right side is going to have 3 lobes within it, and the left side is going to only have 2. And that is due to this right here, which we see and we call the cardiac notch. And that is the space that the lungs carves out for the heart to sit there. And so that is why it has 1 less lobe, so that there is space in our body for our hearts to function, which is, of course, very important. And then within the lungs, there are the bronchi, the bronchioles, and the alveoli. And then within the alveoli is the capillary beds, which is a bit more detailed than we necessarily need to be too concerned about, but just knowing that the capillary beds is where the actual gas exchange and the chemistry of that happens is important. And then knowing that the alveoli is the very small part, the bronchioles are a little bit bigger, and the bronchi are the primary parts that break off from the trachea. And this all combines to create what we would call the respiratory airway, or the respiratory passageway. And that passageway also includes the trachea, which we can see right here a little bit on this diagram. It's also going to be called the windpipe in casual conversation. So that is a good thing to understand and know when you are going into a setting clinically to be speaking with patients that they may not understand or place immediately where the trachea is when you say trachea. But when you say windpipe, they'll say, oh no, okay, I understand. That's where my air that's coming in through my mouth gets down to my lungs where it needs to be. On that same note, it's also important to understand that with inhalation and exhalation, and then inspiration, and just knowing that using the words inhale and exhale are much better understood and are going to be much more helpful for our purposes within a clinical setting. But anyways, for the trachea, this is comprised of about 16 to 20 cartilage rings, and those rings are then attached via smooth muscle. And so this creates that passageway and that tube that connects down by connecting the cartilage to hold it strong, and then the smooth muscle to connect those pieces in between all the way down. And due to the smooth muscle, the trachea is very flexible, very bendy. It has a lot of movement, considering that it is has cartilage in it. And that is similar to all of the muscles of our system in the way that those have lots of movement to them. And there are many, many muscles in the respiratory system. The biggest one, and the one that I mentioned at the beginning, is the diaphragm. This would be our largest muscle when it comes to the respiratory system. It's also the muscle that is going to deal with inspiration, which is a very large part of the respiratory system. So looking at the diaphragm, you can see that it has some sections to it. It's this dome shape that is an inverted dome, and it has space there within it to create holes for both your spinal cord to go through and then also veins and arteries to pass through. The diaphragm is going to have the phrenic nerve innervated, so that's going to be where it gets the neurological signals, is through the phrenic nerve to tell it when to contract and when to expand. And then the diaphragm, its main purpose is to move on the vertical plane, so to elevate and to deflate the thorax, so to lift it up and to be able to provide, when we inhale, to create this space for us to breathe in. And so it lifts up and elevates the rib cage so that we have space when we breathe in. And it's a very large muscle that serves that purpose, but it is not the only muscle that serves that purpose. We have a few muscles of inspiration. We also would have our external intercostals, which play a similar role in that they also are elevating the rib cage, and they have sister intercostals, or a sister muscle with the intercostals, but we will talk about those separately when we talk about muscles of expiration. And so knowing that the external intercostals have to do with inspiration is very important. And then we also are going to have a few other muscles in there, such as the scalene muscles, the sternocleidomastoid, and then the pectoralis major and minor, or your pecs, more commonly referred to also, will all have to do and play a part in any sort of inspiration that would be done. So for those are the muscles of inspiration, and then we were also going to have muscles of exhalation, so when we breathe out. And as I mentioned before, there are the internal intercostals, which have to do with this. And those specific muscles are going to actually be pulling your rib cage back down. And so they would be considered antagonists of the external intercostals, in that they do the exact opposite motion, and they're going to kind of work against each other, so to speak, that they're going to do polar opposite movements in that. But then along with those muscles of exhalation, we also have the abdominal muscles, which there are 4 of them, and they also are going to play a crucial role in compressing the abdomen. And so they are going to include both the obliques, so the internal and the external obliques, and then the abdominis muscles. So there's the transverse abdominis and then the rectus abdominis. And those 4 are comprised to make up the abdominal muscles. And they, along with being for exhalation and decompression of the, or compression of the abdomen, they also are very important for trunk support and for being able to sit upright. So they, as you would say with your abs hold you up. So they hold lots of purpose and serve lots of ways to keep your body. But for the respiratory system, we'd call them muscles of exhalation. So then now we know about muscles. So the last piece that we need to understand then is some of the bones of the respiratory system. So the rib cage is going to be where most all of our bones are comprised. When we look at this, we can see the sternum, which is right in the front of the body. It would be right here on, also called, like, it would be like the breastbone would be a more common term for it. And then around it we have the ribs. You have 12 ribs. The first 7 that we see up here are all going to be considered true ribs, as they connect to the sternum and also in the back to your vertebrae. And then we have false ribs, in that they are the 8 through 10 down here, so the next 3, and they also connect to vertebrae, but then they connect up to the other ribs instead of connecting all the way to the sternum, and so then we'd call those false ribs. And then at the very bottom back here, we can see these ones, which are going to be our floating ribs, due to the fact that they do not even connect in the front. They're just hanging out back there, 11 and 12, and they are just attached to the vertebrae in the back. So those are your 12 ribs. And then clearly in the back you have the vertebrae, which protects the spine. And there are many of those that all have to play a part. But this is your rib cage, which will protect your body, or protect the organs of the respiratory system as the structure for your body. They are in this position where the ones that are posteriorly located they sit more upwards, or higher up on your body, and the anterior ones sit lower. So it creates this slant. But then when you take a breath in and you inhale, it evens out. And then when you exhale, it goes back down. So there's this interesting design of the slant and then the even out in the rib cage as one breathes in and out. So just kind of an interesting part of the design and how that's a purpose of your ribs. So knowing those 4 parts, knowing the details about each of them, it's lots of information. It's important to know how what it is that's working, but we also need to know how it works. And clearly we know how we're breathing. We've labeled and talked about inhalation and exhalation, but we also want to talk about the cycle of this. So we have 2 types of speech or breathing. We would have active and passive. And in other terms, you would think of breathing for life is going to be your passive speech. So that's breathing that you're doing subconsciously all the time, 24/7. This is going to be about 40% inhalation and 60% exhalation as your body is just keeping you alive. So breathing for life. And then there's active breathing, which is going to be any breath that you are doing intentionally. So like as I am right now, I'm speaking. And so that means I am actively breathing, and I am breathing 10% inspiring and then 90% exhaling, because so much of the energy needs to go into the words that are coming out of my mouth and how I am pushing that out of my body. So that would be active breath. And that plays a little bit into what we look at here, which this is a visual that's going to help us try to understand breathing as a whole. So we can look at it to kind of get a view of like the lungs capacity at a whole is just like a good visual way to go into the chart. And then we'll talk about each of the individual points and how they will be able to show us what different types of breathing and breathing capacities and volumes that we have in our body. So right in the middle here, we can see with the yellow or these little red squiggly lines, that's what we're going to call tidal capacity. So that is your passive breathing. That's the amount that you breathe in and out to keep you alive, to keep you going. Much smaller in here, but that's just what's necessary for your lungs to keep you alive. So that's the yellow. And then above it, we have this blue, and below it, we have this green. You can see it spikes way up here in the red or way down there. And those are going to be our reserve volumes. So we have an inspiratory reserve volume when you breathe in, and that is going to be your active breathing capacity. So the amount that you can breathe in when you are breathing more than your tidal capacity. So as much breath as you can take in. And that would be, of course, inspiring. And then the same goes for when you are breathing out. So expiratory, and that would be the amount that you can breathe out when you're trying to actively breathe out past your tidal volume. And so clearly much higher, there's much more that our lungs can do than just what we're doing to keep us alive. But when you combine these 2 things, when we take our reserve volume plus our tidal volume, we can see our inspiratory capacity. So that's the max amount, the max volume of air that your lungs can breathe in. And then that creates like the cap basically for the as much as you can possibly breathe into your lungs. And then on the bottom here, interestingly enough, we don't see the same thing because we have this pink down here. And this pink is going to show us residual volume. And that's the amount in our lungs that is always going to be there. This is a constant 24/7. Your lungs must always keep air in them. So there will always be a little bit left, no matter, even when you exhale as much as you possibly can, when you get to that maximal expiratory level, you still have this pink, this residual bit left in your lungs that's there. So it's important to understand when we're looking at the graph to know that there's always this understanding of a bit below that will constantly be there. And so when looking at that, we can see that there's an overall vital capacity, which is from the most that you can breathe in to the most that you can breathe out. And that's kind of understanding your body's vital capacity and its ability to fully maximally breathe in and maximally breathe out. And vital capacity can also tell us a lot in the SOP realm of just understanding about how people's breathing is going, how it's affected. If there's any sort of disease or impairment to the lungs, then they're going to have a smaller vital capacity. It's going to be decreased. And so being able to look at that chart and understand it and understand the why at a basic level is really important, so that we can then go out and see what it looks like when it's at a way where it's not how it's designed to be, and to know, okay, I fully understand what it's supposed to look like correctly, so then what is it going to look like incorrectly? So that is the purpose of all of this, so that we can know, yes, this is how our respiratory system is designed to work. Okay, now let me go evaluate what it looks like when it's not working to its ideal design. So I hope that this was helpful and that it was able to give you an understanding of all of those things.